localized GB17 right below the EOP to see if I have periaqueductal ray involvement, and I don't. So whenever you have anything, where's that?
That's right, list.
Okay. Because I can't therapy localize both sides, I'm just going to rub it. It has the same effect. And that, so we know that we've got, next slide, body map issues. Okay. So now I want to check and make sure I don't have some sort of segmental interference. And K27 doesn't strengthen it, so put your hands on the side of your head. So now we're just going to IRT her parietal cortex, the sensory strip. Okay, we'll do this again. And push. And strong now. So we assume we've kind of reset her brain's view of her pain. And then the last thing we're going to go through is, next slide.
Can I ask a question on the vestibular ocular complex? Did you take a shortcut to do that? You know, to check it? I mean, because, you know, like, what I did is, you know, like, I had him standing there, and then I had him go near part, you know. Like,
Well, she didn't show the need for VOR.
okay, was that a shortcut check?
Yeah, that's a challenge for her.
Okay, go
Yeah,
ahead.
you put it.
Is it in? I didn't
It's
see
in
it.
there.
Okay, it is?
Yeah.
Okay.
So the next thing we're going to do is suprachiasmatic nucleus peripheral oscillator mismatch. Okay, so TL glucovella, okay, and K27. Close your eyes, push. So what do you think is going to show up on her is where the mismatch is at? Where was our initial problem with her? Where's her gut? Okay, push it. And that's where it's at. So, and interestingly enough, if you have any doubts about what nutrients you want to give her for gut, you can check them against this mismatch. Like if you want to use Repair-Bite or something, have her check Repair-Bite and see if it doesn't make that go away before you reset it. It'll help you determine what's going on. So we're done with this patient. So see how that we just kind of flowed right through that. We're done with this patient for the day. And what I would look at is I would test her at this juncture on manganese, Repair-Bite, probiotic, and get that gut fixed up, find out what she's doing with her diet to cause this leaky gut thing, which could be Lord knows what, you know. I mean, it's often wheat, dairy, NSAIDs, alcohol, stress, you name it, but that's what's going on. So our common denominator is nutritionally, or neurochemically, the common denominator was GABA with a little serotonin poking its head in there. In one respect, we found that on the startle reflex. So we know that she needs possibly manganese or B6, but when you repair the gut, it may take the need for the manganese away because the liver won't be getting such an overload. And we know we've got GABA issues, gut issues. So we kind of really narrowed it down to something pretty slim.
I have a question about the alpha-ketoglutarate conversion to GABA, right? That's the B6 dependent pathway.
Yeah.
So is it possible that instead of all the manganese, that the citric acid cycle is fine, but it's that zinc phosphorylation stuff you talked about last time?
Possibly. Yeah.
Okay.
But my money's on because her gut showed up.
Okay.
And she's burning manganese up in phase 1.
Okay.
Yeah.
That makes sense.
That's where my money's at in this one. Yeah. And we're going to.
I'm sorry, just tell why you skipped the vestibular ocular reflex.
Oh, she did. We have the screening for it where you have them stand in the gait position, look left, eyes to the right. If that doesn't disrupt gait, then she doesn't need that treatment. That's the screening for it. I mean, you can go through and test all that if you've got time. But in my practice, I don't have time, to do that. So I screen for it that way. And I'll bet over 90% of the time that's a pretty accurate screen for it. Because again, we have to learn how to do this stuff in such a manner that we can reasonably clinically apply it so we can make a living doing it and still provide it for our patients. Because if it takes you 2 hours to treat a patient, you're not doing anybody any good. So. Okay, do you want me to go through one more before we break into, or how comfortable are you with what's going on?